In 2010, health practitioner members from Together and United Voice took on a national public sector wages policy of 2.5%, took on the entire state government and Queensland Health, who were looking to cut their conditions. This is the story of their campaign.
Queensland Health did a deal.
At the start of this campaign, they were seeking to cut our wages and conditions and roll back many of the improvements we've made through HP1 and earlier campaigns.
Obviously, taking away conditions from the workplace is a ridiculous proposal. People aren't going to take that. They're going to fight.
What they don't realise is if we didn't do our jobs the way we do them at the moment, the health of the Queensland public would be severely attacked.
This is not just about us, this is about our profession and the continuing quality of our profession.
A lot of the physiotherapists that I was working with had strong views on our working conditions, but I felt that we were a little bit separated and that we did need to all come together.
People who are 40 and 50 and 60 years old who've never taken a day of action in their life, suddenly standing up and saying, I'm not going to do this anymore, I want to be part of this action.
Our first action was to actually stop data entry throughout Queensland. It was actually a ban that our members really enjoyed doing because a lot of the times the data entry stops us from doing the work that we prefer to be doing, the actual patient care, looking after the children's teeth in Queensland.
What I enjoyed about the campaign was the opportunity for member input.
It wasn't just Union Head Office doing the campaign for us, we were actually part of the campaign and integral to the campaign.
As a negotiator, there was no way that we could have gotten anywhere past Queensland Health and into the government's ear without that fantastic support.
They were really enthusiastically involved in meeting with their local members of parliament. They signed petitions and got the parents of their patients to sign petitions supporting the action that we're taking.
I met a lot of great people who were really committed to our cause. Sometimes it's very frustrating and I can feel quite low about it, but the people at work certainly boosted me up and gave me the energy to go on.
The highlight for me was working consistently with the steering committee delegates and others who led the campaign with such courage and passion.
We've done our homework and we've planned, we've thought about our strategies. We spent quite a bit of time, the two unions together, United Voice and Together, discussing what might happen, how health might try and divide us and what we might do if that happened.
Just seeing that lack of awareness on the part of the Queensland Health negotiators was really quite illustrative.
Through the actions that were taken right throughout Queensland by members with all of the bans and strikes and the rallies that people attended, we were able to knock off the 2.5% wages policy that the state government put in place and maintained all of our conditions.
I think the main reason that the campaign was successful was because of the high level of union membership when we actually had to take action, the amount of people that were proactive in taking action, and most importantly was the communication. We could directly and quickly and effectively communicate with people all across the state.
Great result, but that result comes from the hard work and dedication of the delegates and the members.
It wasn't just HPs by ourselves, we actually had a lot of support from our AO comrades and we now need to show that support back to them.
I think the best thing about the campaign was, as being a new delegate, seeing the large number of people that were getting together and experiencing their passion and really experiencing the passion that they have for their jobs.
But it was so good just to see everyone come together and really stand strong and really put it out there in a really physical and visual way that this is not going to happen and we're going to stand for what's right.
I particularly loved the day we went to the PA hospital and some of the respiratory scientists and others there had made special signs that said, you know, you can't get blood out of a stone for pathology and have a heart for cardiac scientists and all these amazing slogans that really demonstrated what a great job HPs did in Queensland Health for the community.
Wasn't long ago, Queensland Health did a deal. Divide the HPs, you'll be better that way. So it wasn't surprising, on July 7th, they sat down and said, we're
treasurer. Surely a fair man wouldn't side with that lot. So all of us emailed and stood there in shock. I said, listen, you're lucky, you still have a job. From little things, big